Ladies and gentlemen, this is a story that came out on Market Watch December 9th, 2018. First, the doctors were accused of getting patients hooked on opioids, and many believe that was the start of the plague that we're looking at now in America. Now, there are accusations that the dentists are doing the same thing. Are dentists hooking patients on opioids? A new study says patients getting the painkiller for wisdom tooth extractions face increased abuse risk. Well, damn, how much are they prescribing? Wisdom tooth extractions might lead to more suffering that could, in theory, last years. That's according to a new study that says the procedures may end in opioid abuse for some patients. The study released this week found an almost 7% increase in the risk of persistent opioid use after reviewing 2015 prescription records for dentist patients between the age of 16 and 25. The findings suggest that a substantial proportion of adolescents and young adults are exposed to opioids through dental clinicians. Okay, which I'm not surprised. I mean, the same meds that many doctors prescribe for pain, dentists will prescribe those same drugs. Use of these prescriptions may be associated with an increased risk in subsequent opioid use and abuse. Monday's study is another reminder on the risk related to the painkiller medication. You know what this is, ladies and gentlemen. The ones out here abusing the drugs, they are actually ruining it for everybody. That's what they're doing. Okay, let me get back to this. Last week, the Center for Disease Control and Prevention said opioid abuse was partly to blame as average American life expectancy edged down to 78.6 years in a third year of slight average life expectancy decreases. The CDC noted two-thirds of the 63,632 drug overdose deaths in 2016, 22 states, y'all, involved opioids, which include heroin, fentanyl, and oxycodone. The latest study started with a data set of almost 750,000 people aged between 16 to 25, which happens to be around the time wisdom teeth become a problem. Within that group, nearly 13% of the patients received one or more opioid prescriptions. The patient received a powerful painkiller. Dentists were the ones writing the prescription in 30.6% of the cases. The study scrutinized 14,888 patients who received opioids through dental work and compared them to a group double that size, which didn't get painkillers. Dr. Alan Schroeder, the study's lead author, said the findings left him with questions about the amounts of opioids prescribed and why so many wisdom tooth extractions were happening at all. Patients with the painkillers received about 20 pills on average, and such a large number could tempt misuse or diversion of unneeded pills, he said. Schroeder, an associate research chief in the Pediatric Hospital Medicine Division of Lucile Packard Children's Hospital, Stanford, credited dentists for reducing their opioid prescription amount over time. Still, he added, I think we have a lot more work to do. Here's what they found: 6.9% of the group with received a subsequent opioid prescription in the following 90 days to a year. Before their first prescription, they didn't have any record of, opioid use in the preceding 12 months earlier. By contrast, just 1%, the controlled group, ended up with an opioid prescription in the same time frame. 5.8% of group exposed to opioids then had at least one encounter with medical providers who gave an opioid abuse related diagnosis. The same thing happened for a mere 0.4% of the control group. All right, so look, you're prescribing the same drug to the general public, even as a dentist. So it is not surprising that people are getting these drugs and you're still seeing the same result of folks abusing it. The sad part is there are people that are in pain and have chronic pain, and they can't get these drugs as easy as they once used to. And they're not abusing the drugs, but the people that are abusing now has cost them the use of any type of pain management from opioids. But, what are you going to do when the system is now treating everybody like they're a junkie, when everybody's not a junkie? But that's how it's always going to happen in this system. They always go extreme to the point where, the people that really do need the help can't get it now. And this is another reason why you're hearing the suicides going up among the people in chronic pain now, because their doctors have cut them off. But now you have the dentists that are fueling the fire by giving so much opioids out to people getting dental work done. But one thing I have to say, this article didn't really tell you how many, in those prescriptions that they're handing out, how many opioids are each patient getting. They didn't mention that in this entire article. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.